Hello, I'm Dr. Jeffrey Niezgoda, and welcome to another edition of the Wound Care Window. We've got some exciting information to share with you today. So it should come as no surprise to any of you watching this video when I say I am an old man. I've been around for a long time, doing this for a long time. You can see the gray hair just gives me away. But I also wanted to take advantage of that position. I have a young son who is hopefully going to be a medical student someday. He wants to follow my footsteps, and I would like to introduce you to him right now. So this is my son, Jonathan. He is working in our clinic as an MA. He is a certified hyperbaric technician, and he is also a vascular technician. So he's sort of a jack of all trades, but he's getting experience learning the ropes from the ground up in medicine. And Jonathan, welcome to this little segment.
Thank you for having me.
So we're going to share with you some exciting things. Jonathan has some experience in this area, and we're going to do a joint presentation. So Jonathan and I are going to be sharing with you a brief presentation called the utilization of near-infrared spectroscopy imaging to evaluate tissue response to therapeutic interventions. Jonathan has been very diligent in collecting a lot of images using the near-infrared spectroscopy camera from Kent Imaging. That's called the Snapshot, right, Jonathan?
Yes, it is.
We're going to share with you some of our insights. This insight revolves around a patient, his initial evaluation, and some of the therapy that he received here at AZH. We saw him in initial consultation, and he presented with a gangrenous left third digit, as you see here. Now, he came to us having had vascular intervention, and he was billed out as being vascularly maximized. So he was sent to one of our expert podiatry consultants, colleagues, and underwent a toe amputation a few days after that initial presentation. If you look at this photo, you can see that he has significant necrosis of the incision with significant ischemic change around the entire wound. Jonathan obtained a Kent image, a near-infrared spectroscopy image. Jonathan, want to explain that technology just a little bit?
So near-infrared spectroscopy is a up-and-coming technology that is utilizing the difference in deoxygenated versus oxygenated hemoglobin. Deoxygenated and oxygenated hemoglobin both reflect different wavelengths of infrared light, and this camera captures that and measures the difference between them, and then presents us with this image that you see here, this full color image.
So here you see on the right the image of the patient's digital image, what we typically use for clinical management. And here you see a near-infrared spectroscopy image. So Jonathan, I'm assuming that everything is blue, is deoxygenated, and correlates with poor tissue perfusion.
That is correct. This patient here is a little bit difficult to photograph, for instance. There is that large black area in the middle of the foot. That isn't because that patient or that area is deoxygenated. It's simply because the way this camera works with the light reflection, any shiny surfaces, and you can see on the full color image, won't reflect light well.
But nonetheless, we want to see everything bright yellow and red, which indicates good oxygenation. Everything that is not well oxygenated, correct?
That is correct.
All right. So this is a pre-endovascular intervention. We decided that based on the compromise following the surgical incision, that he need to be reevaluated from an endovascular standpoint. So my colleague, Dr. Siddiqui, who is a wizard with wires, he is the plumber here in our clinic and does a very excellent job. Took him back to the cath lab, and he did have endovascular intervention, as we see. He had to have his left superficial femoral artery opened and stented. He also needed work of the popliteal artery and posterior tibial artery with laser and stenting as well. So he was not maximized from a vascular standpoint, and this correlated with the outcomes post-surgery. Following the endovascular intervention, 1 week later, John, what are we seeing here?
We're seeing a very significant increase in the oxygenation of the digits in the foot as well as the wound bed.
And if you look at that, John, there's less ischemia, there's some early granulation, so clearly this snapshot camera with near-infrared spectroscopy is correlating very nicely to what we're seeing clinically. And here you see a pre-endovascular intervention and then a 1 week post photograph. And John, I think, at least to my untrained eye, that looks quite a bit better, wouldn't you say?
Yes, it does.
So again, we're using this camera to follow and track the clinical outcomes. We also decided that we would do some DermaPACE and some hyperbaric therapy for this patient based on his compromised diabetic foot ulcer and surgical incision that was compromised. We have a full service here in our wound care clinic, and we have just wonderful hyperbaric technicians and hyperbaric chambers to complement our patient care. And we're also utilizing DermaPACE. Jonathan, it looks like that's you getting ready to DermaPACE a patient.
Yes, it is.
What is DermaPACE?
DermaPACE is an acoustic shockwave therapy device. What that means is it sends pressure shockwaves into the affected area, and that can help promote granulation tissue, epithelialization factors, growth factors,
and pre-angiogenic factors. And the idea here is that we stimulate the tissue to enhance blood flow, right?
Yes.
So the question is, can we see this with the Kent camera? Very interesting. We did a DermaPACE and a hyperbaric, and here is a photo looking again at a digital image compared with the SnapshotNIR infrared imaging, right, John?
Yeah.
And that's pre-DermaPACE, pre-hyperbaric. Here you see the image post-DermaPACE therapy. Again, Jonathan, I would suggest to you that there's a profound difference following this DermaPACE therapy.
Definitely. We're seeing a lot more tissue perfusion, and there
Oxygenation.
is oxygenation, and
correlating with the improvement in the color.
yes.
Right, great. So can we get any better following DermaPACE and hyperbaric? So we combine the two, and again, I think you would see and agree that this shows a nice improvement in that area. And if you look at that space where the wound is, we're getting some nice oxygenation and perfusion of that tissue, which is going to correlate to healing. So this is a 1 week outcome summary. A pre-intervention, if you remember that image from before, you see a very dense area of blue and light-colored tissue coloration correlated with poor tissue perfusion, poor oxygenation. And then following our interventions, endovascular, DermaPACE, and hyperbaric, we've really resolved a lot of that compromise, improved the tissue perfusion and oxygenation. And what I'd like to suggest to you is that this near-infrared spectroscopy technology is providing us with an ability to actually clinically monitor these patients and ensure that the outcomes that we're hoping to achieve are in fact being achieved with our therapy. Jonathan, are you excited about this technology?
I am really excited to see this technology grow and to continue utilizing it in conjunction with good clinical outcomes.
Great. So once again, thanks for joining us. Hope you found this interesting and educational, and I hope you've enjoyed meeting my son, Jonathan. Jonathan, want to say goodbye?
Goodbye.
I just wish he could afford a haircut.